Hello everyone, welcome or welcome back to the channel that is AMS MBBS Lectures. In today's session, we're going to continue the same topic that is HIV and AIDS under CVS Microbiology. And this is the last part wherein I'm going to describe the treatment of HIV and AIDS, guys. Okay, and also we are going to cover this topic that is post-exposure prophylaxis. Okay, so when it comes to the treatment of HIV, guys, treatment of HIV means antiretroviral therapy. Now, what is this antiretroviral therapy? It simply indicates the usage of all the approved antiretroviral drugs for the treatment of HIV and AIDS, guys. Okay? Now, one thing that you should remember, that is this ART is not going to kill all the viruses. Okay, it does not kills all the HIV virus that is present inside the body. Okay, and neither it is going to, nor it is going to cure the disease completely. Okay, so it is not capable of killing all the virus present inside the body. It is not going to completely cure the disease as well, guys. Okay, why is the reason? Because you know that HIV is going to persist within the lymph node and it is going to replicate over there itself, right? But okay, putting the patient on ART will help in fulfilling the following goals. Okay, it will help enhance, or it will help what you can say, increase the lifespan of the patient. That is, it is going to help in the prolongation of the life. It will also help in the improving the quality of the life of the patient. This is what are the clinical goals that it is going to fulfill. Then it is also going to, okay, reduction in the, it is going to reduce the viral load. It is going to cause a significant reduction in the viral load. Also, it is going to enhance the immune system. Okay, it is going to help in reconstitution of the immune system, both quantitatively as well as qualitatively, guys. And lastly, it is going to reduce the transmission of HIV from the infected individual to the others, guys. Okay, so though ART is not going to, okay, though ART is not going to completely cure the disease, or it is not going to kill all the viruses, but at least it is going to fulfill the following goals, guys. Okay, now when it comes to ART, guys, this antiretroviral therapy, guys, what's the indication to start it? Okay, so, guys, the latest guidelines provided by NACO in the year 2021 states that we have to treat all. Treat all is the new guideline, guys. Treat all the patients irrespective of their CD4 T cell count or their clinical stage, their age, the population, or the associated opportunistic infections. Okay, irrespective of all these criteria or factors, you have to start the treatment. Okay, you have to treat all the HIV patients with the antiretroviral therapy. Now under ART, guys, okay, we are providing drugs. Okay, this ART के through जो हम लोग drugs देने वाले patient को, it is provided through this thing that is your highly active antiretroviral therapy, that is HAART. Now when I say HAART, it simply means the use of a combination of at least three antiretroviral drugs, guys. Okay, and why are we using a combination of three or more than three drugs? Because this HART is going to suppress the HIV. Okay, it will help suppress the HIV effectively, and also it is going to stop the disease progression. Okay, it is stopping the disease progression. So these are the two important reasons why we are giving the antiretroviral drugs in a combination of three, guys. Okay, now what is monotherapy? From the name it's clear, it indicates the use of a single drug for the treatment, guys. And this thing, single drug ka use karna for the treatment of HIV, and this monotherapy is contraindicated. Why it is contraindicated? The first reason is because of its inefficacy in suppressing the suppressing the HIV. So we can say inefficacy is one of the reason, and the second is the risk of development of resistance against the drugs, guys. Okay, this is another reason that why monotherapy is contraindicated. Now, when I say HART, okay, what are the three drugs that are we giving? So that three drugs is nothing but the TLD regimen, guys. Okay, it is the TLD regimen, and this is the NACO's recommended first line HART regimen that we can use, guys. Okay, now please remember this thing over here, this TLD regimen, it is nothing but a fixed dose combination of three drugs, and that is your T stands for tenofovir, okay, 300 milligrams of tenofovir with lamivudine, and that too also 300 milligrams. Okay, it is a fixed dose combination, all these three drugs, and D stands for dolutegravir. Okay, dolutegravir, and this is given at like 50 milligrams of dolutegravir. A combination of all these three things is given as a one tablet once daily. Okay, one tablet once daily we have to give it. Okay, that is the TLD regimen provided by the NACO, guys. It is the first line HART regimen recommended by NACO, and that is the TLD regimen, which is nothing but it is a fixed dose combination of tenofovir, lamivudine, and dolutegravir, which is given as one tablet once daily. Clear? Now, once the patient is started on the TLD regimen, guys, every 3 to 6 months, we have to assess the CD4 count as well as the viral load of the patient in order to monitor the response to the treatment, guys. Okay, so this thing is what you have to do every 3 to 6 months. Okay, this will help you understand whether the patient is responding to the treatment well or not, guys. Clear? Next thing over here states that is with respect to the opportunistic infections, guys. Okay, if the patient is also having some opportunistic infections, so you have to treat the opportunistic infections adequately treat karna hai using the appropriate antimicrobials, guys. Okay, antimicrobials. Now, whenever we know this thing that during the later stages of HIV, the patient is going to develop some or the other opportunistic infection, this is something that we know. And since we know this thing, therefore, we can prevent the occurrence of these opportunistic infections by giving the prophylactic treatment to such patient, guys. So if a patient is in the initial stages of HIV, you can put the patient, okay, you can give the patient along with the TLD regimen, you can give cotrimoxazole to the patient for, okay, as a preventive therapy for pneumocystis pneumonia. You can give the patient fluconazole, guys, for the prevention of cryptococcal meningitis. And lastly, we can also give the patient isoniazid, which is an anti-tubercular drug. Why? Because it will help prevent the progression of your latent TB. Latent TB infection को active disease में convert होने से prevent करेगी isoniazid, guys. Okay. So this was the guidelines for the treatment of opportunistic infections, including its prophylactic measures, guys. Okay. Next slide, okay, states that the problems that are related or pertaining to the use of this antiretroviral therapy. So as you, okay, as very commonly, guys, koi bhi drug, okay, if you are giving, the most common problem that you can face is the associated toxicity or the adverse effects. And when it comes to ARTs, guys, the adverse effects is the lipid abnormalities and some drug interactions are the एडवर्स इफेक्ट्स एसोसिएटेड. तो ये चीज होती है ना. ये जो एआरटी के जो ड्रग्स मिलते हैं, जो टीएलडी रेजिमेंट के ड्रग्स होते हैं, दे आर बिट कॉस्टली, गाइस. ठीक है, तो दैट इज वन थिंग, दैट इज द हाई कॉस्ट ऑफ द रेजिमेंट. दैट्स अनदर प्रॉब्लम. Also, there is a risk of development of resistance against it and the dissemination of the resistant viruses. And also, guys, for the treatment of HIV, guys, we have ART as one of the main source. यानी कि जो treatment के options हैं, the therapeutic options are very very limited with respect to HIV. But this is also one of the problem, guys. And lastly, we have this problem that is called as your IRIS, that is immune reconstitution inflammatory syndrome. What happens in this, guys? ठीक है, immune reconstitution लिखा हुआ है यहाँ पर, है ना. So it simply means there is a AIDS वाला patient है हमारे पास, ठीक है, and the patient is in the recovery phase, है ना. He's already started with the ARTs पे उसको हमने start कर दिया उसका antiretroviral therapy. Now in this thing, because of the patient is taking this ART drugs, the viral load is going to decrease and the immune system will begin to recover, guys. Viral load is decreasing, immune system is getting recovered, it is getting reconstituted, guys. Okay, and we know yaar it's a AIDS का patient है, मतलब opportunistic infections तो हुई होगी इसको. Yes or no? Now this improving immune system and is going to generate an exaggerated immune response against the previously acquired opportunistic infection, which is resulting into an overwhelming inflammatory response over here, guys. Okay, and that is going to worsen, and which will definitely worsening the symptoms of, which is going to worsen the symptoms of the infection, guys. Okay, but that is the last problem pertaining or related to the use of ART, that is immune reconstitution inflammatory syndrome over here. Makes sense? From the name it's clear, and I have also given you a flowchart over here to explain this thing. Clear? So that was all about the treatment, okay, with respect to HIV, guys. Now we're going to study the topic that is called post-exposure prophylaxis. So here we are having this post-exposure prophylaxis. Now, why are we giving this post-exposure prophylaxis? This is mainly required to reduce the risk of transmission after an individual is exposed occupationally towards the HIV, guys. Okay, and this, okay, if I give an example, it is mainly all occupational exposure. If I say an example, if I give you, it is the healthcare workers, and the best example would be of healthcare workers, and via, okay, like via the needle stick injury or a sharp injury that is taking place. That is, I'm going to say simply, if the exposure is through the mucocutaneous mode to the HIV. Okay, all these individuals, okay, all these cases के अंदर we require the post exposure prophylaxis, guys, and every hospital should have a nodal center for the PEP management, which is going to provide the PEP, the post exposure prophylaxis, completely free of cost to their employees, guys. Okay, and which are the drugs that are we giving under this PEP? So PEP can be giving the same TLD regimen. And if someone asks you what is TLD regimen, it's a fixed dose combination of the three drugs: tenofovir, lamivudine, dolutegravir, and this is also the preferred regimen when it comes to post-exposure prophylaxis. Okay, indication की बात करूं, when the source is unknown or the source is positive for HIV, these are the indications for giving the patient a post-exposure. Sorry, giving the individual, okay, the post-exposure prophylaxis. Okay, so let me give you an example over here. Suppose let's take the example of a lab worker or a lab technician who is handling multiple blood samples. Due to some reasons, guys, now definitely the lab technician hai who's handling the blood sample, they does not know na this blood sample is coming from an HIV patient or not. Okay, they don't know this thing. Now while handling, due to some reason, they got an exposure to this blood, guys. Okay, so now for this lab wala example, can I say that the source is unknown? We don't know the source, right? That whether the blood sample is coming from an HIV patient or not. And second, let's take the example of the nurses or a doctor who is knowing that he is going towards a he's going to take blood sample. Just for an example, I'm saying is going to take a blood sample from an HIV positive patient, and while taking the blood sample, the nurse or the doctor accidentally pricked themselves, guys. Okay, so in this case, can I say that the source was positive for HIV and this was something already known? In both the cases, they should immediately reach to the nodal center of the PEP management present in their hospital or nearby to them, and where they should be registering, okay, they should be reporting this case that they got an exposure to this thing, and they should be starting the TLD regimen, guys. They should start taking the TLD regimen, and the duration, if I say that they should, this thing should be like started. The TLD regimen should be started within 2 hours of exposure, and it should be continued for the next 28 days तक के लिए continue करना है. Okay, so this was all about the post-exposure prophylaxis. Last thing, that is the NACO guidelines to prevent the neonatal HIV, guys. Okay, what do we mean by these things? Okay, let's understand this thing. Now suppose I'm saying there is a woman, okay, a pregnant woman, okay, who was diagnosed as HIV positive during her pregnancy, guys. So ऐसे case में you have to start that pregnant woman with a lifelong ART. And when I'm saying ART, which regimen we are going to give? So we are over here, in case of a pregnant woman, we are giving the TLE regimen. Again, I'm saying we are giving the TLE regimen, and we are not giving the TLD regimen. This is not given. It is the TLE regimen that is we are giving over here. So dono regimen mein what is the difference? It's simply the dolutegravir of the TLD regimen is replaced with the efavirenz, and the remaining two drugs are the same, that is tenofovir and lamivudine. Clear? Now next thing, guys, we know this thing, that is one of the mode of transmission of HIV is the perinatal mode of transmission, that is from the pregnant woman to the fetus it can be transferred. Yes or no? So now the newborn baby of such the, okay, of such a pregnant woman who was HIV positive, guys, will also be exposed to HIV. And in order to prevent the development of HIV in this newborn baby, guys, after birth, the newborn baby should be given the syrup Nevirapine. Nevirapine syrup deni hoti hai for a duration of 6 weeks. And this duration of giving the syrup Nevirapine can be extended to 12 weeks if the mother's ART is less than 24 weeks before delivery. Let me explain what do I mean by this thing, guys. Simple hai, okay? If you know that the mother is a known case of HIV and she was already on antiretroviral therapy, so after the delivery, after birth has taken place, you have to look for the duration of the ART the mother was taking for. Okay? You have to simply check that how long was the pregnant mother was taking the antiretroviral therapy or the antiretroviral drugs before delivery, guys. Okay? And if the duration of that treatment was less than 24 weeks, then in such newborn babies you have to give the syrup Nevirapine for a period of 12 weeks. And if it was more than 24 weeks, guys, then you have to give it for only 6 weeks. Okay, this is one of the guidelines. And in both the cases, guys, you have to, in both the cases, we have to remember that at the 6 weeks of life, you should also start with the cotrimoxazole prophylaxis, and which has to be continued until 18 months. In both the cases, you have to do this thing, guys, at 6 weeks of age. So this was all about the NACO guidelines to prevent the neonatal HIV, guys. Okay, with this we have covered the prophylactic measures as well for HIV and AIDS, guys. Okay, so with this we mark the end of this topic, HIV and AIDS, completely. We have described all these topics in different parts. Okay, so you can definitely watch out if you haven't any. Okay. So that is it for this session, guys. Thank you so much for watching. If you found this content useful, then do like, share, and subscribe to the channel. That is AMS MBBS Lectures. And if you have any questions or queries, then do comment down. I'm there to answer it. See you all in the next one. Bye bye.